Our chief medical correspondent, Dr. Jon LaPook, is here with me. Doctor, I want to get back to this, what they're calling a breach of the protocol. What does that mean? It sounds like as they describe it, we've now confirmed it was a nurse, that somehow or another, all the things that the nurse was supposed to do, apparently the nurse made some sort of mistake, maybe taking off the gloves. What do you read into this?
Well, it says to me that you really have to rethink where exactly these patients who are diagnosed with Ebola should go in the best of circumstances. Mm-hmm. So there, as you pointed out earlier, there are 4 medical centers around the country that are specifically set up for these high-risk infections. And they're in Emory, Nebraska, NIH, and Montana. And of the 6 patients who had Ebola treated in America, now there are 7, I guess, 3 of them were at Emory, 2 at Nebraska. In Emory and Nebraska, 2 of these high-risk centers, they're specifically trained to deal with it. No healthcare worker has been infected. And so I asked, the first thing this morning, I reached out to Tom Frieden, who's the head of the CDC, and I said, what about considering, an abundance of caution? Of course, every hospital has to be able to diagnose it, but once you're diagnosed, being sent there. So I just got this back a few minutes ago, and this is what I heard back from the CDC. The developments in Dallas are cause to double down on all our efforts to make sure healthcare workers and hospitals are properly trained and that they meticulously follow guidelines while triaging potential Ebola patients or providing care to Ebola patients. Any hospital across the U.S. must be prepared. However, as we continue our outreach efforts, it may be a prudent measure to suggest certain hospitals which have specifically trained personnel and which have exercised their Ebola response plans thoroughly be prepared to receive first. So I'm reading this as saying, yeah, that may be a good idea to, once you have a diagnosed patient, move them to these high risk.
To these 4
Well, and they run through the
hospitals.
drills, in fairness to places like Dallas and places all over the country. We have not run through these drills in the way that these high-risk centers have. So when do you make the mistakes? In the first couple of times you see the
Well,
patients?
I mean, is it your surmise, and it can't be anything more at this point, that maybe what happened, this nurse took off the gloves or something, and that's how this was passed on? You don't think this means there's some new mysterious way that we didn't know about before?
No, and I know Dr. Frieden said the same thing, and this is a great time not to have magical thinking. There's 40 years of experience treating Ebola. We know how it's transmitted. There's no evidence from a huge New England Journal review a couple of weeks ago that this virus is any different than any of the previous viruses, that it's mutating or anything like that. We know that to protect the community, it's a public health measure. So the individual patient sadly died in this case, but what protects the community is the public health system, isolating the person, making sure you track down their contacts. And I have to say, after some missteps at the beginning where the apartment wasn't clean, people weren't moved out, the healthcare system did a very good job responding to this, and in fact, it took only 48 hours for the CDC to track down all 48 contacts.
We have to move on, but let me just ask you this. My sense of it is probably dialysis might be the most dangerous part of this test.
I agree with you. When I heard, and people were saying they didn't do a full-out effort, when I heard that they gave him dialysis, that involves a lot, probably people here have not seen what that involves, a lot of body fluids. You're filtering the blood, and also intubation when they put in a breathing tube. So that meant they were going all out, and there is a potential to get exposed to fluids when you're doing these dangerous procedures.
Okay, Dr. Jon LaPook, thanks so much. We'll be back with our panel in just a minute.